Hello, I'm Chang Sang Park, prosthetic urologist practicing in Seoul, South Korea. My practice is hyper-specialized and hyper-focused with the inflatable penile prosthesis surgery. Today I want to talk about the penile implant, why people getting it, and how I have seen it. So in the beginning, I thought that people are getting it to have a lot of sex. They're just so-called sexually more, oriented or focused people will want to get this one done. After I started my practice, after a year later, oh boy, I was wrong. Most of the patients I had is around early 60s or mid 60s, and they were getting this surgery for their peace of mind and not for their partner. They were getting this for themselves to feel like a man again. What they told me was striking, because when first they have a problem with erection, they felt like part of them as a man is living away from them. They felt like they are not a good man anymore, and because of that, psychological pressure became really huge burden to them. His wife said that, why are you not doing the trashes? Why are you not doing dishes? He felt like she's doing this because I'm impotent. She's maybe saying that because I couldn't satisfy her. So it really stressed him out. As a matter of fact, I don't think that she was doing that because of that kind of reason. Well, I don't know, but I suspect that was the case. Still, for him, the sense of him being impotent was crucifying him. After the surgery, most of the men, when they come 6 months later, the number of the intercourse was not increased. Actually, some of them are decreased than before. I asked them why. They told me that, well, before the penile implant, when they didn't have a good erection, they couldn't get satisfied with the intercourse. So they would keep trying it so to get a better satisfaction. But after the penile implant, they could have a great satisfaction with the intercourse. So it's like an appetite. He couldn't feel the urge to have a more frequent intercourse. The older man gets, the less frequent we can feel the orgasm. That's true. However, in this case, I don't think that that's the case of the decreasing orgasm, because it was just 6 months. So obviously, men were having a very satisfying erection. That seems like a great argument or great relief for their identity. Many studies shows that how they feel about their genitalia does affect them deeply. There is a congenital disease called hypospadia, which is the urethral opening is not at the tip of the penis, rather is stopped at the mid shaft or the bottom of the penis or something like that. If a child has that, textbook recommendation is that we should fix it, correct it before the boy goes to the kindergarten, so that he compared his genitalia with the other boys, and then that can really be traumatic for his development. And the other example may be there are very unique congenital conditions, like when men or women have 3 nipples, and that should be also corrected before he or she got exposed with their peers. In regard of that, penile implant is to restore the physical function, but ultimately, this is for the psychological or try to treat our mind. This is the reason why I generally want to see my patient 6 months later. Around 6 months later, when I see them, almost all of them showing a recovery of the physical function. But what I really want to see is that if the surgery went well, you will be able to see patient become a little more different, become a little more happier and less angry, and sometimes their gait become more confident, and their voice is a little more booming, happier person. When I was in residency, during my urology residency, my center was very famous for the cancer treatment. We had a lot of patients coming in for the cancer treatment. And after the surgery, basically, we saved them from dying. But penile implant surgery, however, I did not save patient's life from death. No. I just saved his penis. Surprisingly, 6 months later, almost all of them are very happy and very thankful about what I did. So there must be something I still do not know, right? Back in the day, medicine was only trying to save people from the disease or death. But now, with the advancement of the technology, I believe medicine can help people not just surviving, but make them live fully with their physical function, which can help their relationships and make them happier. That's what penile implant do, I believe. That's what penile implant surgeons should aim for. So I think what we should really think about is how patient will regard it. Because we should try to cater what patient desires. Because the goal of this penile implant surgery is a patient satisfaction. And in terms of that, penile implant is a really unique surgery. This is a quality of life surgery. We do not do this for the cosmetic purposes. We are not trying to make the penis, get longer or take no. But we are doing this so that patient can regain their weakened or lost function, which will make their life happier. I want to stress that penile implant is, yes, to restore the physical function, but the real goal is to make man feel more like a real man again. How we can restore his psychology with this physical correction.